Hello everyone. Cardiac arrest is the most life-threatening condition that you will have to manage as a medical professional. The line between cardiac arrest and death is very thin. What you do in the initial few seconds to minutes after a person goes into cardiac arrest will determine whether that person will survive or not. Time is life, and what you do in that time can save a life. When somebody collapses or becomes unresponsive, the most life-threatening condition that you need to think about is cardiac arrest. Unfortunately, precious time is lost because many people fail to recognize this. Cardiac arrest can happen anywhere, anytime. It can happen at your home, at any public space, and definitely at your hospitals. Now, if you encounter such a situation at a public place, do not approach the victim unless you make sure that the scene is safe. For example, if you encounter somebody getting shocked from a power line and collapsing in front of you, do not go and touch the victim unless you make sure that the power supply has been cut off. Your safety is the most important thing. In hospitals, it is presumed that the scene is generally safe. To identify cardiac arrest, you need to evaluate for the triad of cardiac arrest. This includes unresponsiveness, pulselessness, and breathlessness. To check for response, tap and shout. Tap hard on the patient's shoulders and call loudly. Are you okay? Are you okay? If the patient is unresponsive, check for the patient's pulse as well as breathing simultaneously. Radial artery pulsations are not always reliable. It may be absent in elderly patients, those with vascular diseases, as well as in hypotensive states. The best place to look for pulse are the carotid arteries, which are the accessible vessels closest to the heart. To check for carotid pulse, turn the patient's head slightly to the opposite side. Palpate the thyroid cartilage and slide your 3 fingers into the groove between the trachea and the sternocleidomastoid muscles. Feel for the carotid pulse for at least 5 seconds, but not more than 10 seconds. At the same time, scan the chest for breathing. 1001, 1002, 1003, 1004, 1005. At times, you can find patients in agonal gasping. Mind you, agonal gasping is not normal breathing, and it is a sign of cardiac arrest. So if your patient is unresponsive and does not have a carotid pulse and is not breathing, or is having only agonal gasping, then that person is in cardiac arrest. You need to call for help and activate the emergency response system, which is called as code blue in most hospitals. He has no pulse, he is not breathing. Sister, he is in cardiac arrest. Activate code blue.
Yes, sir.
Code blue, 4th floor, room number 401. Code blue, 4th floor, room number 401. Code blue, 4th floor, room number 401.
The Code Blue team is a multidisciplinary team which is capable of providing advanced cardiac life support care at the bedside of the patient who has suffered cardiac arrest. While the Code Blue system is getting activated, your responsibility is to initiate the patient immediately on high-quality CPR. The cornerstone of high-quality CPR is high-quality chest compressions. Chest compressions help to maintain the perfusion to vital organs like the heart and brain during cardiac arrest. To deliver chest compressions, stand or kneel down near the patient's shoulder. Hold your hands in this manner with your non-dominant hand on top of your dominant one. Place the heel of your dominant hand over the lower half of the patient's sternum or the breastbone. This point can be easily identified by joining the midline with the internipple line in males or the inframammary folds in females. Keep your elbows straight and locked. The force for chest compressions should come from your shoulders. Push hard to a depth of at least 1/3 the anteroposterior diameter of the chest wall. This comes to at least 5 cm or 2 inches in depth. Try to avoid compression depths of more than 6 cm to prevent any mediastinal injuries. Compressions should be provided at a rate of 100 to 120 per minute. You can target an average of 110 compressions per minute. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Now, it is very important that you allow the chest to completely recoil in between compressions. This will allow the venous return to refill the heart with blood that can be pumped during the next compression. After providing 30 compressions, you need to provide 2 breaths using back mask ventilation. For effective back mask ventilation, it is very important to get a good seal between the mask and the patient's face. And it is also very important to open the airway by doing a jaw thrust maneuver. One of the best methods to provide effective back mask ventilation is by using something called as the CE clamp technique. The C part will help you to get a good seal and the E part will help you to open the airway. After opening the airway, provide 2 breaths with each breath over 1 second.
1, 2.
This can be provided by squeezing the self-inflating bag by about 1/3 to 1/2 of its volume and watching for chest rise. Now, if you have an advanced airway in place like an endotracheal tube or a laryngeal mask airway, instead of the 30:2 compression ventilation ratio, you can provide continuous chest compressions, and 1 breath can be provided every 6 seconds during ongoing chest compressions.
1001, 1002, 1003, 1004, 1005, 1006. 1001, 1002, 1003, 1004, 1005, 1006.
But be careful not to hyperventilate your patient. Hyperventilation can increase the intrathoracic pressure, which in turn reduces the venous return, which in turn reduces the cardiac output during chest compressions. Finally, the most important step during CPR is to minimize any interruptions in chest compression. Interruptions during chest compressions can reduce the perfusion to the heart as well as brain, resulting in poor outcome. Studies have shown that the survival is highest when the chest compression fraction or CCF is more than 80%. CCF is the ratio of time that the team has spent on chest compressions to the total cord time. Chest compressions are usually interrupted for delivering breaths, to switch between compressors, to analyze the heart rhythm, to check for pulse, and even for intubation. It is best practice to minimize any interruptions in chest compressions to less than 5 seconds. To prevent compressor fatigue, it is also best practice to switch between compressors after every 2 minutes of chest compressions and ventilation. This is roughly after every 5 cycles of compression and ventilation, with each cycle being 13 compressions and 2 breaths.
20, 24, 25, 26, 27, 28, 29, 30.
1,
Next switch.
2.
Checking for pulse. 1001, 1002, 1003, 1004, 1005. He's still in cardiac arrest. Let's continue CPR.
3, 4, 5, 6, 7, 8.
Continue CPR until advanced cardiac life support is initiated. Remember, high quality CPR is the foundation for advanced cardiac life support as well. CPR triples the chance for survival in your patients. CPR saves lives. Are you okay? Are you okay? 1001, 1002, 1003, 1004, 1005. He has no pulse, he is not breathing. Sister, he is in cardiac arrest. Activate code blue.
Yes, sir.
Starting CPR. 1,
Code
2,
blue,
3,
4th floor,
4,
room number
5,
401.
6, 7,
Code blue,
8,
4th floor,
9,
room
10,
number 401.
11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
1, 2.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
1, 2.
1, 2, 3, 22, 23, 24, 25, 26, 27, 28, 29, 30.
1,
Next switch.
2.
Checking for pulse. 1001, 1002, 1003, 1004, 1005. He's still in cardiac arrest. Let's continue CPR.
3, 4, 5, 6, 7,